Nicole, and today I'll be showing you how to set up for surgery. So at our clinic, the first thing that we do is we come over to these cabinets. We get out our robe for the right size doctor. So now that our robe's out, you look over here on this shelf, we have different size gloves. So fill out your first pair of gloves that your doctor needs. I'll lay those out. I will get my blade. This is just a 10 size normal scalpel blade. I'm going to lay it out. Also, I'm going to lay out my doctor's mask. That way when she comes in, everything is laid out for her. A lot of our doctors like to use sanitizer, so we have it out. That way they can sanitize before putting their gloves on. So now that that is laid out, I'm going to come over here. So the first thing that we want to look at over here is going to be our ISO machine. There's a dot over here that's black. You want to make sure that it is got plenty in it. So we keep the extra ISO over here. So just going to add to this and fill it. Up to the dotted line. Put the lid back on this. So then, take a little bit and screw it back on kind of tight. You want to make sure everything is hooked up. You want to make sure that you have the right size bag. That way, the right size bag is for the right patient. You want to make sure your tubes are the right size. Everything is attached and hooked up. You want to make sure your oxygen is on. Make sure that when you turn it on, that ball goes up. Now that that's on, this is our monitor. We normally turn it on. Everything will be set up and ready. So to actually set up the table, the things that we go by are, you come over here, we take 2 towels and 3 potty pads. So this is our hot water blanket. So I'll lay it to the side for a second. And I lay out my first towel like this. Put my water bed back on top. So then I come over here. I'm going to get my trough. Put my trough under it. I'm going to use my other towel. Open it. Just like that. Put my 3 potty pads out. That way, as the doctor's working, if something gets messy or they want a fresh area, they can just move the potty pad and they have a clean, fresh area to start. So, here we go. 3 potty pads. So then, normally, we unhook these, lay them out. I'm not going to do all this, I'm just going to tell you, these are the monitors. They do hook to the dog. They hook to the front legs, back legs to monitor everything. We have the SpO2 monitor. We have a temperature. We have the tube that connects to the dog, actually once the dog has been tubed. This monitors our blood pressure once you put a cuff on it. So I'm going to roll this back up. So once that's set up and turned on, you want to make sure your water bed is turned on and warming so that the patient will be warm. Something else we do have a heater that is over there that blows warm air directly to the dog so that if your patient gets too cold, you can hook that up. So another thing that we have, all different size trach tubes. I don't know if you can, all different size trach tubes. So you get the one you would want. In here we have empty syringes. So that way you can inflate the cuff once the animal has been tubed. We also have our string that we use that you would pull off a piece, break it off, and then you can tie it around the dog's head once we have been tubed. You just kind of make your little knot, put it over the end of the trach tube, pull it like that. Oops. Okay. It's a lot easier when it's inside of a dog, but you just take it, tie the knot, pull it kind of tight, and then it'll stay, and then it's inside of the dog. That way, the dog can't swallow it, it stays in place, it's around their head, super easy. So that's our trach tubes. We also have eye gel. That way we can gel the eyes once the animal is sedated. We do have the lights. They're nice and fancy because it's really important to have good lighting when you're working with animals. Our scrubs are over there. Trash can is down there. I think that's everything that we do when we're setting up for surgery. So you have to then get your pack out. So you're going to spin you over here. This is our tray that we use. So I'm going to put this like right here at the end of the patient. Let's see. You're going to want to get a pack. This one has already been autoclaved. So what you would do is you would unfold the pack. Like so. You pull the tape off. Super sticky tape. So that would be done. You would go ahead and unwrap by just the tabs. Like that. So our blade is over there for the doctor. I'm not going to open that until she gets here. But you take the blade. I would open it and put it on here for her. We also have different monocryl, suturing, different things like that. So whatever size the doctor would need, you would have that. So now everything is ready for the doctor. When she comes in, she's ready. So that's how you set up for surgery. Put this over here. So now that surgery is over, what you would do is this would all be thrown away. So I'll take it, fold it up, because it would be down in the trash can. So we'd throw it away. We would break our towels down, put them in the laundry. This trough has a little spot that it hangs over there. So the towels would be put in the laundry, like so. I'm going to put that in the laundry. This hangs back up. We wipe everything down really well with bleach. Make sure it's cleaned. All of our utensils would go, that's where our chalk's hang. All of our utensils would go into a container that would then be taken to our sink out there to be cleaned. That way they're always sterilized properly, and then they would be autoclaved. And then once this is wiped down with bleach, we do sweep them off really well. We make sure all the machines are off. You want to make sure that everything is still plugged in and connected really well. We wipe off all of our monitors, put them back when they go, turn the monitor off. You turn the heating blanket off. You want to make sure that your bag is wiped down, your ISO is off, oxygen is off. You want to make sure your tubes are still connected really well. And then that's how we break down for surgery. So, yeah, it's not terribly hard, but I do like to get the next robe out, the next set of gloves out, and the next mask out for the next doctor. So there, that's how you set up for surgery.